are ready.
We're back in open session.
Is Dawn ready?
It's on, yeah.
Okay, we're back in open session. Do you want to go through the sub-recipient agreements real quick?
Yeah.
Yep.
I move we sign the sub-recipient agreement with Russell Oklahoma Fire Protection District,
Turn the light so you can see us.
$7,678.87.
Second.
All in favor?
Aye.
Move we sign the sub-recipient agreement with JQ's on high for $5,000. Small business.
Mm-hmm.
That's a
Second.
distant cousin.
Second.
I'm gonna abstain.
Okay, all in favor? Aye.
Abstain.
I move that we sign the sub-recipient agreement with La Chica Loca for $2,993.
Second.
All in favor?
Aye.
Okay.
All right, Teresa, we'll turn it over to you then.
Sounds good. So just a quick update. So we did get quite a few applications these last couple days before the close. I think we're at about 15 that we've received here in the last handful of days, including the holiday weekend and things. So we're going through those, and my plan is to have all of those on the agenda for Thursday. There might be some, emails and things I need to send to people to get additional information that we might not have at that time, but I at least want everything on the agenda so that you can see everything that we've gotten. So that's where that's at right now. As far as what I'm bringing forth today, this is mostly just going to be the internal ones that we've got, and then one that I did receive some information for. So if you look at your funding recommendations, I'll skip the municipalities, the public schools, and go straight to the internal. So DO 406, this is for the sheriff. I'm not sure if he's brought this to you. These are respirator fit testers for some masks, some very specific masks. That's kind of all I know about it. I'll go through all of them and then you guys can discuss. DO 802, the juvenile court had some additional attorney's fees because of so many continuances because of COVID. So that's what that $12,000 for. And then the recorder of deeds, they're asking for electronic conversion of the aperture cards. I had that application pulled up so I could be more in depth with that one. I'm not sure if this one has come in front of you yet, but from what I understand, it's all paper, so anybody that wants to look at anything has to come into the office and pull that. So this would just be a way to maintain that those people don't have to come into the office anymore. It would be converting 787,000 images, and they said if there's not enough money for the complete project, they would request some kind of split as well. So those are the three internal ones. Are there any questions over those?
Not on those.
Nope.
Well, I'll move on to the only other one that I'm going to bring forward today, and that's in the not-for-profit. That's F00191. This is one I've been going back and forth with them about exactly what they're asking for, and we finally kind of came to an agreement for this $1,826, and that's for some PPE, a little bit of telework technology for them, and just to get them aware. So I'm not bringing forth any of that payroll information. They didn't really meet the threshold of anything that was substantially diverted because of COVID. It was just more needing help with their payroll. So I'm bringing forward the $1,826 for approval. And that's all I was going to bring forward today. So I do have a couple out there that I think I have all my questions answered, so I'll bring those forward on Thursday in the small business category. I got some rent information from a couple, so just didn't have time to put it on before today.
So I'm good. I mean, I just, I didn't know if you guys wanted to spend $144,000 on the electronic conversion of Aperture cards or.
You want me to say first, or do you want me to wait?
Huh? Go ahead.
I was for it last week, so I'm fine.
Okay. Yeah, these are unusual times, so. I'm good
It's
with
gonna be
it.
our next drinking game every time
Yeah.
you say that. These are
Yeah.
unusual times, drink.
They are, ooh, I like that.
You
I'll provide the
All right.
soda.
Sorry.
The soda. All right, I move we approve D-0406.
Second.
All in favor?
Aye.
Move we approve D-0802.
Second.
All in favor?
Aye. Move we approve D-02-03.
Second.
All in favor?
Aye. Move we approve F-00191 for 1826.
Second.
All in favor?
Aye.
Okay, the only thing else I was gonna talk about today was the reporting deadline for November. They do have a deadline of 12/8. I have talked to them and they are willing to grant extensions for that. So I don't know if Christy and Debbie are both in the room, but I was thinking of asking for 12/14 as an extension date, and just kind of wanted to get their idea on that. We can talk about that later if that's something they want to think about, but I just wanted to make sure to bring that up today. But
Teresa,
again, we'll get that all settled and figured out.
that would be great because we are making payments today that still include November. So
Okay.
those checks are being cut today. So for me to turn that around to you before Thursday would be pushing it. So if we can
Okay.
get that pushed.
Is
to-
12/14 enough time?
Yeah,
I could ask for.
I should
okay.
be able to run your reports by the end of the week and hopefully we can get
Perfect.
them approved next week and be ready to report.
Okay, that'll work for me. So I'll go ahead and get that requested and approved. So yeah, that's really all I had to talk about today. We'll have a big meeting on Thursday with all the information that we got from the deadline. But I don't see any reason why we can't bring all that forward, at least in an idea for some of them. And you can get a good idea of what's left out there for applications and what you'll have for internal spending as well. So any questions or concerns?
Teresa, I don't know if I thought I sent you and Julie an email Thursday, the time of when we'll have the meeting again. I'm guessing 2 o'clock. Is that still gonna be available with you guys?
2 o'clock on Thursday,
Yes,
this Thursday?
yes.
Yeah, I think I can make that work. I'll have to check with Julie.
Is that okay
Yeah,
with you
that's
guys?
fine for me, but I'll check with Julie. But I'm sure she can make it work too. So I'll put that on my calendar.
Might be done earlier, but
So Teresa, do you think these other eligible costs will be what you bring forward on Thursday with some additional ones, or?
Yeah, so what's in the eligible cost right now, that's gonna be a little high. I mean, cause for like, the municipalities, I basically put everybody at 300,000 as a maximum, depending on what you guys decide. So that'll get maximized out. But I think for each allocation area, so each 300,000 area that you gave the cities, the schools and the healthcare, I think we'll have enough applications and you'll kind of have to figure out where you want to go with that. But as far, I haven't looked, I have somebody that's working through them right now. I haven't looked super close at, but it's a good mix of all different areas. I think we've got a few small businesses, a few not-for-profits, nothing that's gonna exceed, what we're at there for that unallocated amount. So I think we're okay with that dollar amount, but as far as kind of that potentially eligible, yeah, I would say probably at about $1 million, depending on internal, if you guys have any internal stuff that you put in there. So 300,000 for each, and then probably around 100,000 for the not-for-profit / businesses that I'll be bringing forward.
Okay.
Okay,
So we already approved the stuff for the courts. But then that email that Kristen sent, they went over on several things.
Right,
Is
so,
that-
so we need to talk about that. So they have some areas where they didn't use everything that got approved before. They have other areas where they went over, and then they have some additional requests that they wanna make. Do you want them to submit a formal application for those changes? Do you want to allow them to use kind of the money set aside in different ways? How do you wanna handle that? And
So from what
I
I
think the building outside, they're kind of looking for guidance from you all as to what or how you want to do that.
From what I understand, Judge Beadham's gonna be here tomorrow talking about that stuff.
Okay.
And trying to, I guess, give us some options and see which way we wanna go.
Okay.
So then tomorrow we can say, fill out the application, let's get it rolling, or, but they went over on some of these things, so they've already bought some of these things?
They have, so he did say in his last email that they had a few additional items that they needed to work from home, so they went ahead and ordered them, but they're hoping that they can still apply for reimbursement from CARES.
If they can't, then who's paying for it?
I guess
State?
they are.
State one? Oh, that's nice.
Interesting.
I'm after the state today, so look out. Okay, well, I think John's gonna talk about it tomorrow. and
Okay.
Judge Beadham will.
Still like
we can
your
have some
sign though. Did
direction
you see
there.
my mask?
Nice.
Yeah. You get one of those every 50 years, that's pretty cool.
Let's see, when's the last time Dallas
It's not 50 years.
won the Super Bowl?
It's not 50 years.
Okay, Teresa, we will see you on Thursday.
All right, 2 o'clock
Yeah.
Thursday. I'll get Julie on too.
Thank you.
Thank
That's
you.
all. Yep. Thanks, guys.
Thank you.
Thank you.
So did you want to talk about the,
We can talk about Thursday if they.
well, you came up here this afternoon, so talk about the request for media or for education.
Right, so those, just gonna take this over here. Just hold on.
You take this one.
Here, I'm gonna leave. I think mine got approved, right?
Yes.
That's all I care about. Thank you.
So with the Monday meetings that we've been having with the hospitals and the city, it's been pretty educational because we get to learn what's going on. You know, like 2 weeks ago, each hospital had like 40 or 42 COVID patients. Yesterday, they each had 20. So we talk about things like that, but one of the things that we still have been talking about is education for the public. And the proposal, I submitted it, but it was a proposal that I think the mayor solicited from a media organization here in Jeff City to try to get more of the message out because I think that people have, you know, pandemic fatigue. They're tired of hearing social distance, wear your mask, wash your hands. And the group thought that having a creative way to get those messages out might be more well received. And at the health department, we would like to add more messages to that. You know, we feel like it's very important for people to be healthy and exercise and get fresh air and take their vitamins and boost their immune systems. That way, no matter what virus they come into contact with, they're less likely to get it or be more willing to fight it better because, you know, their bodies are better prepared and have a better immune system. I know that EMS also mentioned that, you know, we need to educate people about when to call for EMS and that we need to educate people about when to get tested and when to seek medical care. You know, there's some schools of thought that maybe our hospitals are more full because people aren't seeking medical care because they don't know when to call the doctor or they don't want to go to the ER because they're afraid of being sick or whatever, and people need to stay home once they get tested. You know, they talked about that on Monday, that people they're tired of waiting for their test results because it's taking so long. So in the meantime, they're out and about. You know, we got test results today that from somebody that was tested on November 7th.
Jeez.
So, right, it's a little bit too late to quarantine now, but, you know, so sometimes it's just taking a long time, you know, for whatever reason, and people are getting tired of waiting. So instead of waiting, they're going about their business shopping. So there's still a lot of messages that need to get out there to the public, you know, and we feel like this aggressive marketing campaign would be beneficial, and it's not just coming from the health department, and it's not just one Facebook message or one news article. It's everything. It's Twitter. They want to do some creative videos with some of the doctors, you know. Anyway, anyway, so that's what the marketing campaign was. I submitted it yesterday, so I guess it didn't get,
Just didn't get reviewed
in
before
time.
May.
So, I mean, if you want to wait. to
It's
discuss
radio,
it,
it's everything. but-
It's everything. It's
And then
TV,
there's-
it's radio,
that would-
it's Twitter, it's,
There would also be PSAs that would go with
So
them.
who gets to decide what's on it?
well, we will have a committee, and Jennifer Walken from our office, who's our public health educator nurse, I would like her to either be in charge of the committee or at least be on it. The hospitals also said they have some marketing staff that they could put on it, but we would provide, Bucket Media is the one that submitted it, the messages we wanted, and they would find creative ways to get the word out. So I would like Jennifer to be either in charge or our main lead on it.
So they're all messages that will go out prior to the end of the year?
No,
No, it was a
that's what I,
4-month campaign. That was one of the questions.
Yeah, I would say you're gonna get an email back asking that.
Right.
yeah, they're talking a 4-month campaign.
Mm-hmm.
And I brought up, I said, we've got till the end of December, so, you know, and they said, well, go ahead and pay them in advance. And I'm like, I don't know. So,
Can't you do a media buy though in advance? I mean, typically you can. I mean, typically you have to pay for it in advance.
I'm sure you can, I'm just not sure that they would.
Well, I
allow
think
that.
they're gonna have the same issue that they have with like a maintenance agreement on something. If they see the documentation that you're buying 4 months worth of media, they're going to prorate it down to just the month's covered.
I guess
And
we need to
the
just
the
see.
majority of the cost, I think, is the development of the messages. I don't know, I didn't get to.
I got a feeling by the
have it
time, this
necessarily
is
with me.
December 1st, by the
Oh, yeah.
time we get it done, you've only got maybe 10 days or 2 weeks. And so, well, we'll see if there is a way, if we could purchase the
Yeah.
advertising in advance and see
Wasn't
if we.
it till March? Didn't you have till the end of March?
I think you can encumber, but it needs to be an expenditure now, so like you could order something and if it doesn't come in and you don't pay it until January, February, that's one thing, but it has to be an expenditure now. You can still pay it then, but
But if it's an expenditure now, could the messages still continue until then?
Just have to talk to them.
Yeah, we need to just see.
Okay.
So what's the target market? Who are they trying to get to that has not been gotten
All
to?
ages.
Every
Yeah.
day, every hour, every time you turn on the radio, the TV, Facebook. I don't do Twitter, so I don't know about it.
I think
but-
they're trying to get to everybody, and they're trying to,
Okay, so who have they missed then? Because that's who they need to target, is the people they've missed so far.
well, and
And
I
they're
think
not
it's
gonna
not
have
just,
Twitter and
yeah,
Facebook and-
right, and it's not just the people they miss, it's the misconceptions that are out there too. I mean,
But then, that's my problem with it, is the misconceptions, nobody knows who or what to believe at this point. So, I don't know how much more advertising is going to do anything for them. I mean, I guess there is some out there that can tell you just keep social distancing, that's the main way to do it. You mentioned something about when to call an ambulance. There's some validity to that, but
Quarantining, mask, and my big
you're
thing
gonna
is,
do that on a
my
TV
big thing has
commercial.
been mask care because the
You know
Right.
what's
blue
gonna
ones
happen
you've
if it's on a
got,
TV
you wear
commercial?
once.
Click, I'm gonna click it
Well,
back to the other football
it's-
game.
But you get Dr.
I'm not even
Haight,
gonna watch it.
You
Click.
get Dr. Haight.
Click.
I don't want, Carrie said, oh yeah, she and I can do these. I don't want, our doctors need to be the ones doing them. You need to be, I
I don't want to be.
we're not, we don't need to be doing
that
it.
on purpose.
Nobody's gonna give a damn if I tell them, you need to wash this mask every day.
And some people, they've heard all they want to hear, and they don't want to hear it anymore.
Now, don't get me wrong, I think education is a huge part of it, so people know what to do if they think they have it, or to stay away, think they've been exposed, or, even if they're feeling sick, should they call an ambulance, or should they, call their doctor and see where they tell them to go? I just wasn't sold on this proposal, so. Guess wait and see what they say tomorrow. If they say we can do a 1 month thing, maybe we do a 1 month thing, get some more education out there, but I do want some say on what goes on them. I mean, I'd like to see it before it's gonna go out there. I don't know if there's anything in particular I'm looking for that I don't want put out there. But-
Maybe it's just more about healthy living and.
Healthy lifestyles.
Yeah, being healthy than
That's what I need, more commercials tell me I need.
Well,
exercise.
I think
You're
if
gonna
you
tell
do,
me I
if
gotta
you,
Quit drinking
What's
beer.
them to you? Push-up bras do not help push-ups at all. I tried that. this
if you are
weekend.
quarantined at
You're right.
home because your child has COVID, you need to be quarantined for 14 days.
Oh,
I
If-
don't know, see, we're supposed to be, yeah.
And if you're,
We've heard the
if,
new
We
guidance is coming
digress
out.
badly, Jeff.
It's 4 o'clock, man.
I-
They
This
might
has
be-
been an all
they
day
might
thing.
be-
and we are gonna do some newspaper too, Jeff. Yeah, just so you
It's
know.
been what?
It'll be interesting to see what they have to say about what we can or can't do
Yeah.
with the
Yeah,
advertising,
that's fine,
so.
yeah, and we can talk about it Thursday, but that is the proposal from that group.
Okay.
I'm the sacrificial lamb and the messenger.
I can put on a
Just the messenger.
tuxedo.
No, I definitely wasn't killing you. I just was asking questions about it.
We could all put on our tuxedos and we could sit here at Three Amigos and we do a commercial.
And we have stogies and bourbon. People might believe us.
I'll check this.
Dr.
Every time I tell you,
Beam
you
says,
can't
drink this every day. Oh, we're still on, aren't we?
Has that ever stopped us before?
Also, for an internal question, we're still trying to get a revised quote from Brady's on our windows, because they're not working right now. So they were dragging really bad from the weight of them, so that's still coming, I can still submit that. We're like begging
So
them
is
for.
that the way they were put in?
I think they're too heavy, the space is too big, and
Too big,
the
too-
rollers, it's
too-
not, I don't know, they're not working. They've been out to fix them a few times.
Don't break it.
Can you do it?
That saved me from getting COVID when you
They
did.
use- I think
at the
they're,
bottom?
I think they're gonna do like a middle one and have 2 slide instead of having 2 huge ones slide, because there's too big, so they're gonna do in 3 pieces. So it's not so much trying to slide, because it's too heavy for the tracks.
Okay, anything else? Move we recess till 4:30, which is not that far off.
Second.
All in favor?
Aye.
Tell them they need more paper next time.
Yeah, really,
Jesus.
for $3,000. Had a
Yeah.